Do you frequently feel like your heart hurts sometimes, not physically, but emotionally, like sadness just sits heavy in your chest? Or maybe you've been unusually tired, losing interest in things you once loved, your favorite songs, hanging out with friends, or even eating. Now, what if I told you these feelings might not just be in your mind, but linked to something happening in your body? That's where depressive disorder due to another medical condition comes in. Imagine your body is like a car. If the engine, say your thyroid, isn't running right, the whole car might slow down, even if the driver, your mind, feels fine. This kind of depression happens when a physical illness, like cancer, diabetes, or a stroke, messes with your brain chemicals and emotions. It's real, it's not your fault, and it's more common than you think. So what causes this kind of depression? Think of your brain as a messaging center. It uses chemicals like serotonin and dopamine to send feel-good signals. But when another illness attacks your body, like Parkinson's disease, multiple sclerosis, or even a long-term infection, it can disrupt these signals. For example, let's say your friend Sam was doing fine until they got diagnosed with thyroid disease. Suddenly, Sam started feeling hopeless, had no energy, and cried over small things. It wasn't just stress. The thyroid was messing with Sam's brain chemistry. Other causes could be heart disease, reducing oxygen to the brain, or lupus causing inflammation that affects mood. Even brain injuries from an accident can trigger this depression. In short, the body's illness travels up to the mind. How do you know if it's this type of depression? Let's play detective. If you or someone you care about has a medical condition and then starts showing emotional changes, pay attention. Symptoms include feeling sad almost every day, losing joy in hobbies, like not caring about video games or music anymore, sleeping too much or too little, eating way more or less, trouble focusing, like blanking out during meetings, and thinking life isn't worth living. Say your dad had a stroke and now he barely talks, sleeps all day, and isn't excited about his Sunday walks anymore. That's not just part of aging or reaction to illness. It could be depression caused by the stroke. The key clue: the mood changes started clearly after the medical problem began. Diagnosing this isn't like a blood test for flu. The doctor won't just check your heart or sugar levels. They'll also ask deep questions. When did the sadness start? Was it before or after your illness? They might use mood questionnaires or talk to your family. They need to rule out regular depression or side effects from medicine. For example, if your mom is taking a drug for high blood pressure and feels down, the doctor checks if the drug causes depression. Once confirmed, treatment hits two targets, the body and the mind. Fixing the medical issue helps, like controlling diabetes better. But many also need antidepressants that are safe with their condition, or talk therapy. Imagine Maria, with cancer, feeling overwhelmed. Her oncologist works with a therapist, so she gets both medical care and someone to talk to. It's teamwork, like fixing both the engine and the radio in the car. Can we prevent this? It's tricky because you can't always avoid illness, but you can stay ahead of emotions. Think of it like weather forecasting. If you know a storm, like a new diagnosis, is coming, you can prepare. Stay connected, talk to friends even when tired. Keep small routines. Drink water, take short walks, write in a journal. Doctors can also screen for depression early. For example, after a heart attack, patients might get regular mental health check-ins, not just heart scans. Support groups help too. Sharing with others who get it can ease the emotional load. You wouldn't ignore chest pain. Don't ignore emotional pain either. Prevention means paying attention before the sadness becomes overwhelming. Science is moving fast. Recently, researchers are using brain scans to see how diseases like Alzheimer's or diabetes actually change brain areas linked to mood. Cool, right? New studies show that reducing body-wide inflammation with certain drugs or diets might also reduce depression symptoms. For instance, A 2023 trial found that some heart patients on anti-inflammatory meds had fewer depressive signs. Also, telehealth therapy, video chats with counselors, is now widely used, making help easier to reach. Wearable tech like smartwatches can even track sleep and activity to warn doctors of early depression signs. So future care might feel like a smart app noticing your mood drop and gently saying, "Hey, maybe talk to someone today."